Welcome to session 4. I'm Dr. Tracy, psychologist. In the last session, we talked about the importance of understanding anxiety. In this session, we'll do a little digging in the past to figure out the root cause of the anxiety we're experiencing. You will need pen and paper for this session, so if you don't already have it, please pause this recording and come back when you're ready. We all experience symptoms of anxiety on one level or another. Even if we don't have diagnosable anxiety, we can still experience symptoms of anxiety when we're dealing with something difficult or stressful in life. Let's try and figure out what may have initially triggered that fight, flight, or freeze response. Think about when the symptoms first started. Now, this could go back as far as childhood, and it doesn't have to be a traumatic event. It's more about how the situation affected us and possibly changed us. We're not here to judge whether the event was bad enough, especially if we were a child when it happened. As a child, we are more sensitive to life's events and to change, so any type of instability could be considered traumatic for a child. Write down when the anxiety first started. It can be your approximate age or a time period like elementary or high school. Think about your life around that time and what was happening. Write those things down and write down if there were any changes happening in your life. And at any point through this session that you need more time to answer the questions, please feel free to stop the recording and then just continue when you're ready. In thinking about your life around that time and if there are any changes happening, remember, if anxiety is fear of the unknown, any change can cause anxiety, even good changes. Going on a first date, moving, getting married, having a baby, or starting a new job, or trying anything new. Just make some notes without judging the event. Make some notes on what you can remember happening around that time. This event could have set the stage for future responses to stressful events, which means you'll need to heal from it. Because every time you experience something stressful currently, it could be triggering this event as well as all of the other stressful events that have happened in your life. I'll give you an example. We can become anxious and fearful when someone yells at us, or even when we witness other people yelling at each other, not realizing that the fear we're feeling in that moment comes from a much deeper place within us. It could be from a parent yelling at us as a child, or witnessing domestic violence, or being involved in it as an adult. This is the core pain that could be triggering our current anxiety. So we need to heal from it. If you're not able to identify any possible changes or challenges, the problem may be due to someone close to you, like a parent or a primary caregiver, modeling that behavior for you, and you end up copying it. This is, of course, on an unconscious level. Was there anyone in your life with anxiety? It may not have been diagnosed, or you may not have even realized it was anxiety at the time, but now looking back, you may recognize the symptoms. If there's anybody that you can think of, just write that down. We look to our parents or caregivers to see how to function in the world, how to communicate with and treat others, how to problem solve and manage emotions. If you had someone with anxiety modeling this behavior, then you would learn to think and react in a similar way. You may even think the symptoms of anxiety are just part of your personality, part of who you are. You could describe yourself as being a worrier, nervous, fearful, or careful. Maybe you describe yourself as an introvert, or not that social, or controlling, aggressive, dramatic, abrasive, sensitive, emotional, any of these things. But this may not be who you are at all. It may really be symptoms of anxiety. If you think your symptoms are present due to somebody else modeling this behavior, then you've got to realize that this anxiety, these fears aren't yours. They belong to whomever modeled this behavior for you. Assess the similarities between the two of you, or you and the person or people that may have had anxiety and modeled it for you. Don't discount it if the person is much worse than you by thinking, oh, I'm nothing like them, because there could still be similarities that are triggering your symptoms. Go ahead and write down any similarities. Reassess your functioning in the world and what are truly your fears and not theirs. For example, we could get anxious when we meet new people because we believe we're not good at meeting new people. We're scared of embarrassing ourselves or of not being accepted. But which came first? This outcome or this belief? Were you once an outgoing social kid but had a horrible experience of being rejected by your peers, which then led you to create this belief? Or did you already learn this belief through someone else's fears, and then the fear made you scared, which made your fear happen and then confirmed your belief? If you discover your belief came from someone else and not your own experience in life, then that needs to be reworked and replaced. This is the end of this recording for session 4 and the beginning of your therapy homework. I want you to start journaling the possible cause of anxiety. Explore how this affected you at that time and how it could be affecting you now. What emotions did it cause? And did it change you in any way? How did you react in the moment? This is the end of session 4. In the next session, we'll discuss ways to separate ourselves from the anxiety. And as always, please ask questions and share your journey in the course classroom.